Keeping pace with the latest in pediatrics, it can feel like a bit of a sprint sometimes, can't it?
Oh, absolutely. New findings, evolving practices. It really demands constant learning.
Yeah, exactly. And that's why today we're focusing on a really significant opportunity for professional development. We're talking about the Kerala Pedicon 2025.
Right, the 54th Annual Conference of the Indian Academy of Pediatrics, Kerala. It's organized by the IAP Kerala State Chapter and hosted this time by IAP Thiruvananthapuram.
And specifically, we're going to do a deep dive into the pre-conference workshops. They're scheduled for November 14th, 2025.
And there are quite a few, 15 workshops in total.
15, wow.
Yeah.
That's a lot of options. Shows a real breadth of learning opportunities.
It really does. So our mission today is to kind of explore these, give you a feel for what each one offers, and maybe help you pinpoint areas that match your interests or, your practice needs.
Sounds good. Where should we start?
Well, let's kick off with the acute kidney injury workshop. What really jumps out here is that it's not just lectures. They've got interactive discussions and, crucially, hands-on sessions built in.
Hands-on. That's always good. What kind of skills?
Well, a key one is initiating and managing acute peritoneal dialysis. They're offering direct practical training on that.
That's incredibly valuable.
Yeah.
So needed in certain emergencies.
Exactly. And they even get into the specifics of PD in neonates, which, has its own unique challenges.
Right. Very different physiology.
Beyond just the procedure, they're also covering how to evaluate and manage fluid status hands-on again, and tackling tricky imbalances through case-based problem solving.
Okay, so really practical, problem-focused learning. Where's this one happening?
That's at SAT Hospital, Government Medical College, Thiruvananthapuram. They're capping it at 50 participants to keep it focused.
Good to know. And who's the contact?
The contact person is Dr. Ritika Radhakrishnan, and the lead faculty member is Dr. Susan Uthap.
Okay, great. What's next on the list?
Next up, there's a workshop on cerebral palsy. This one looks like a really comprehensive overview.
Cerebral palsy, okay. Huge topic.
It is. And given the long-term impact, early identification and solid management are just so critical. This workshop brings together expertise from different angles,
like
pediatric neurology, physical medicine, orthopedics, and physiotherapy. So a really holistic perspective.
That sounds excellent, covering the whole spectrum.
Yeah, they mentioned covering early identification, clinical diagnosis, the whole investigative workup.
And the management side, too, presumably. Not just theory.
Oh, definitely not just theory. There's a strong emphasis on practical management strategies, and they're using case-based discussions to really drive it home.
And I see they mention one-on-one doubt clearing.
Yes, which is a fantastic opportunity, getting direct access to experienced faculty. That's a big draw.
For sure. Where is this one?
This one's at Cosmopolitan Hospitals, also limited to 50 participants.
Okay. And the contact?
Dr. Rosemary Lawrence is the contact, and Dr. Minnie S. is the lead faculty.
All right. Moving on. Clinical skills and trauma resuscitation. This sounds very hands-on.
It really does. It seems perfect for anyone wanting to brush up on those core clinical skills using task trainers.
Task trainers are great for practice basic procedures, advanced.
It says basic and some advanced procedures.
Fine.
But a big highlight seems to be the simulation training session specifically on trauma resuscitation.
Oh, that's crucial. Pediatric trauma. It can be daunting.
Absolutely. And the chance to run through scenarios in a simulated setting, without the real-world pressure, that can build so much confidence and skill.
Reduce that fear factor, make you more prepared.
Precisely. That seems to be the goal. Familiarity confidence. This one's at Kim's Health, Trivandrum. Slightly smaller group here, 40 participants max.
Got it. Contact person.
Dr. Neetu Gupta is the contact, and Dr. Pramila Joji is leading it.
Okay. Now here's one that sounds incredibly relevant to everyday practice. Navigating challenges in daily pediatric practice.
Yes. This feels really important. Med school gives you the foundation, but the day-to-day stuff...
It throws curveballs.
Exactly. So this workshop aims to give practical strategies for those common hurdles, the things you face all the time.
How are they approaching it?
It sounds like it's heavily based on case discussions, learning practical approaches, and getting guidance from experienced colleagues. Sort of learning from shared experience.
Learning from those what do you do when situations. I like that.
Me too. It's grounded in reality. This one's at SAT Hospital with a limit of 50 participants.
And the context?
The contact is Dr. Hija Suganan, and the lead faculty are Dr. Bindu GS and Dr. Shanavis A.
All right. Shifting gears a bit. Pediatric cardiology, clinical vignettes, and problem-solving a five-finger approach. That title is intriguing.
It is, isn't it? Five-finger approach sounds like a structured way to tackle cardiology cases.
Can you tell what the fingers represent?
Well, it looks like it covers
Yeah.
1, clinical vignettes, 2, hands-on ECG training, really fundamental, 3, understanding X-rays in cardiology.
Okay, 3.
4 is a session called Spot Diagnosis, a comprehensive approach to common cardiology cases. So pattern recognition, maybe.
Makes sense. And the 5th?
Management pearls. So practical tips and strategies from the experts.
That sounds incredibly thorough and practical. ECGs, X-rays.
And they're providing resources, too. A handbook with the clinical vignettes and problem-solving stuff, plus a basic echo reporting format.
Oh, nice takeaways.
Yeah, and that hands-on experience with ECG, X-ray, and echo is key. This one is at CDC Thiruvananthapuram, capacity of 40.
Contact.
Dr. Harikrishnan, KN, is the contact, and the lead faculty is Dr. Zulf, taking a closer look at a clinical genetics workshop. It's happening down at the CDC in Thiruvananthapuram. We've got the details on what this workshop covers, and our mission, really, is to figure out why it might be interesting or, valuable if you want to get up to speed on clinical genetics pretty quickly.
Yeah, and one thing that jumps out straight away is the size. Maximum 50 participants.
Oh, wow.
Which suggests, it's going to be quite intensive, quite hands-on.
Definitely more personal attention that way.
Exactly. And you've got Dr. Vinitha A.O. coordinating. They even list Dr. Sankar V.H. as lead faculty. So experienced people leading it. Let's move on to pediatric endocrine disorders. Diagnosis and management. That's a big field.
Huge field. Absolutely. Complex, too. The main goal here seems to be boosting clinical competence.
In what specific ways?
Diagnosis, management, and treatment across a pretty wide range. Things like diabetes, growth issues, thyroid problems, puberty disorders. Common but tricky stuff.
So improving diagnostic skills, getting updates on new treatments.
Exactly. And they also mention enhancing patient communication, which is so important with these conditions.
Definitely. How are they teaching this?
Sounds like it's rooted in real-world clinical scenarios, emphasizing practical application, all guided by expert faculty.
Makes sense for endocrinology. Where is it located?
This one is at the Institute for Rheumatology and Immunology Sciences, IRSIS, in Pongamudu, Trivandrum, and it's a smaller group, capped at 30 participants.
Okay, more intimate setting. Contact info.
Dr. Veena V. Nair is the contact, and Dr. M. Vijay Kumar is the lead faculty.
All right, now something probably very common in practice. Managing allergies and asthma in children.
Yes, extremely common. This workshop seems very direct, very practical.
How so?
It's focused squarely on hands-on training for diagnosing and managing allergies and asthma in kids. Straightforward skill building for everyday practice.
Sometimes that's exactly what you need. Location.
Ananthapuri Hospitals and Research Institute. They're limiting it to 40 participants.
And the contact?
Dr. Nafil Abdul-Majid is the contact person, with Dr. Krishna Mohan R. as the lead faculty.
Okay, neonatal care is next, specifically neonatal continuous positive airway pressure and ventilation.
Yes, critical skills for anyone working with newborns. This workshop dives deep into neonatal lung development and function first.
Laying the groundwork.
Exactly. Then it moves into evidence-based guidelines for actually implementing and managing CPAP. Plus, expert guidance on ventilation modes, settings, troubleshooting.
Troubleshooting is key with vents.
Absolutely. And it's not just talk. They'll have live demonstrations of CPAP and ventilator setup.
Oh, good. Seeing it done.
Yes. Plus, interactive case-based discussions. It sounds like a really solid mix of theory, practical demonstration, and problem-solving.
Location and capacity.
This one's at PRS Hospital with a maximum of 40 participants.
Got it. Contact.
Dr. Karthik Raj is the contact, and Dr. Sumitha is the lead faculty.
Moving into development, neurodevelopmental assessment, and follow-up.
Another crucial area. This workshop focuses on, well, exactly what the title says, comprehensive assessment techniques and long-term follow-up strategies.
So what will attendees learn practically?
Practical approaches for early identification of neurodevelopmental disorders, planning interventions, and importantly, the ongoing management, supporting kids and families long-term.
Right, the follow-up piece is often understated but vital. Where's this one held?
At NIMCDRC, also with a limit of 40 participants.
And the contact.
Dr. Hazina KR is the contact, and the lead faculty is Dr. MKC Nair.
Okay. Let's talk about nutrition and office practice, foundational stuff.
Absolutely foundational. This workshop zeroes in on the practical side of infant and young child feeding, specifically in the office setting.
Like what?
Addressing common nutritional problems you see every day, practical tips for managing deficiencies, iron, vitamin D, etc., and office-based interventions you can actually implement.
So really actionable advice for the clinic.
That's what it sounds like. Very focused on what can I do tomorrow. This is at Ananthapuri Hospitals and Research Institute, max 40 participants.
Contact details.
Dr. Gopika Sekhar R. is the contact, and Dr. Elizabeth K.E. is the lead faculty.
Okay, nearly there. Pediatric Gastroenterology and Hepatology Digest Workshop.
Yes, tackling common tummy troubles. This one emphasizes the do's and don'ts in office practice for GI and liver issues.
Do's and don'ts are always helpful. What's the format?
It's described as dialogue-centric, which suggests a lot of interaction and time for questions, focusing on red flags and clinical scenarios.
Good. Recognizing the warning signs. Anything else?
They'll also give insights into pediatric GI endoscopy, functional GI assessment tools, and importantly, when to intervene in emergencies.
So practical decision-making. Location.
This one says hotel to be finalized, but likely hotel residency towers, also capped at 40.
And the contact.
Dr. Prance K.S. is the contact, and Dr. Geetha Sunil is leading it.
All right. Point of care ultrasound or POCUS. Increasingly important.
Definitely. This workshop is targeted quite specifically.
Who's it aimed at?
Practicing pediatricians, managing emergencies, ER docs, handling pediatric trauma, pediatric postgrads, and fellows in critical care and emergency medicine.
So people on the front lines of acute care. What's the focus?
Basic ultrasound in emergencies, fast protocol training, that's the focused assessment with sonography for trauma.
Essential for trauma.
Lung ultrasound for various conditions, and even using ultrasound for optic nerve sheath diameter to monitor intracranial pressure. Really practical, cutting-edge skills for acute settings.
Sounds very useful. Location.
Kim Shelf, Trivandrum, with a maximum of 40 participants.
Contacts.
Dr. Shijukumar C. is the contact, and Dr. Abdul Rauf is the lead faculty.
Okay, next is practical approach to pediatric rheumatology. Could be a tricky area.
It definitely can be. The goal here seems to be demystifying it for general pediatricians, providing practical, easy methods to diagnose and treat rheumatological issues in kids.
How are they doing that?
Through practical sessions with case scenarios, they'll cover systematic musculoskeletal examination.
Like the PGALs or PREMs?
Exactly. They explicitly mention workshops on PGALs and PREMs, plus learning early diagnosis, spotting red flags, and the importance of follow-up.
What specific conditions?
They list quite a few: approach to arthritis, JIA overview, connective tissue diseases like SLE and JDM, vasculitis like KD and IgA nephropathy, autoinflammatory syndromes, and using labs effectively.
Wow, that's a comprehensive list for one workshop.
It is. Sounds like a solid grounding. This one is at Rumen Hall, SAT Hospital, Government Medical College, Trivandrum. Slightly smaller capacity again, 35 participants.
And the contact.
Dr. Sherman Nazreen A. is the contact, and Dr. Geetha P. is the lead faculty.
Okay, last but certainly not least, safeguarding children and introduction. This sounds incredibly important.
Critically important. And they frame it interestingly, noting that safeguarding, while established in the West, is still kind of nascent in India.
So this is about raising awareness and building skills.
Yes, equipping participants to be effective advocates for children's safety. They mention it might be the first hands-on workshop of its kind at the state conference level.
That's significant. What are the key learning objectives?
To be able to identify safeguarding issues, know how to initiate the right actions to prevent harm, and understand the escalation process for serious concerns.
How will they teach this? It's sensitive stuff.
Through case studies, pictures, lectures, and group discussions. Sounds like an interactive approach to tackle these complex issues.
Where and who?
It's at GG Hospital, maximum 50 participants. The contact is Dr. Rajendran Nair, TM, and the lead faculty is Dr. Krishnamurthy, SS.
Who? Okay, that was a really thorough run-through of all 15 pre-conference workshops for Kerala Pedicon 2025.
It really was.
Yeah.
And it's clear just how much breadth and depth is on offer there. A huge range of learning opportunities.
Absolutely. These workshops look like a fantastic chance for pediatricians, trainees, anyone in the field, really, to sharpen specific skills and deepen their knowledge.
Definitely. From acute care like AKI and trauma, to chronic conditions like CP and asthma, to development, nutrition, safeguarding, it covers so much ground.
So we really encourage you, if any of these sparked your interest, to head over to the registration website. That's www.keralapedicon2025.com.
Yeah, you can find all the details there, participant limits, contact info we mentioned, and of course, how to register.
Take a moment to think about which of these areas really aligns with your own learning goals or, the needs you see in your practice.
Each one offers a pretty unique chance to learn directly from experts and pick up practical skills you can use right away. It's all about that continuous learning, isn't it?
It really is. So thinking about this diverse range of opportunities, what specific area within pediatric medicine are you most motivated to explore further right now? Something to ponder as we continue striving for the best care for kids.